This is Kelly Gilbert. This is the third video post. Neo-evolution was a term used to describe the idea or vision of evolution, that human beings sought to preserve a familiar style of life unless change was forced on them by factors that were beyond their control. So, an example that I came up with for technology that has altered or may alter human evolution is reproduction medications, such as birth control or artificial insemination, or a genetic trait that can modify or alter human evolution. Um, so, as we know, birth control prevents life, and many people have questions ethically about that topic. If the concerns are the side effects of birth control and if it's right to use birth control to prevent pregnancy. Um, and as far as artificial insemination, I know personally of somebody that I work with that is going through that right now. My thought on that is I think it's great that people that have problems or can't do get pregnant on their own, that they have that choice of artificial insemination. Um, Altering genes, I don't believe that that's something that we should mess with. Picking somebody's eye color, hair color, intelligence, um, from the standpoint that I don't believe that that's right for people to use. I think a human is a human, and I don't think we should be altering that. There are benefits to reproduction medicine. An instance, an instance. Um, Preventing teens or helping women that can't get pregnant for whatever reason get assistance with doing so. There also could be healthier people out there if genetic traits were altered in order to cure an inherited disease. So there's a lot of conflicts and a lot of reasons that these are good and these aren't good. Some people are against birth control because you are controlling what is supposed to happen. Same as for artificial insemination. Some people aren't in favor of it because they feel that everything happens for a reason. And again, it's a really ethical question. I think that each individual has different feelings about. I feel not knowing the consequences of changing the outcome of someone is a bad idea. We don't know what can happen in the future if somebody tries to alter. What are the moral and ethical implications of neo evolution? Morals and ethics come into play as we ask ourselves where to draw the line when it comes to birth control and artificial insemination and modifying genes. Um, should anyone be allowed to take birth control? Is it a choice? Is it ethical to prevent life? As with artificial insemination, like I went over before, um, should we allow people at any age to do this? I guess there was one woman who was 60 years old in Germany um, who used artificial insemination and just had her first baby. So again, ethically, is that something that um, is good? Is it something that's bad? Will we overpopulate? Should we continue to pursue this form of technology? And again, in my opinion, I believe birth control can be effective in situations where people aren't capable of raising a child. However, I feel it causes children or much younger generation to become parents at early ages because they feel they are protected. There are many don't there are many that don't worry about protection because of options like like abortions and adoption. Um, and I like the idea of artificial insemination. Like I said, somebody that I work with is going through it now. But again, on the other hand, the woman who is 60 years old that just had a baby kind of makes you ask a lot of questions. And where do we draw the line, and who would make that decision? And I definitely disagree with modifying genes because I think people are made the way they are and they're unique because of their traits. I don't think that it would help us in the future to modify people's genes. And then you don't know what the consequences are at the end of that. There's not at all a lot of studies, and who knows in the future what that would cause. So that is the end of the video. Thanks.